How can real-time data improve outcomes? And how can those outcomes help improve the relationship between payers and providers? Today, we welcome Steve Vaccaro, president of HHAeXchange, to chat about this. Welcome to the CarePayments Pod. I'm Fady Sahhar, and with me is Fady Sahhar, the co-author of the Value-Based Payment blog and DEHQ. And we're very pleased to welcome with us Steve Vaccaro, president of HHAeXchange.
Thanks, Fady. Pleasure to be here.
Great to meet you, Steve. So as a quick reminder, the goal of the Care Payments Pod is to have a quick hitting but informative discussion about healthcare payments, models, and how they affect MCOs, providers, payers, and care recipients. As an advocacy-first group, we want to make sure consumers have the best access to information possible and information for quality care.
Steve, it's good to have you with us. And, you and HHAeXchange have been leaders in bringing forth data and real-time data to both to the providers and MCO so that they can actually improve the quality of care. Please tell us a little bit about yourself, how you got here, and how you helped develop the HHA platform.
Sure, absolutely, Fady. So, again, as you mentioned, I'm Steve Vaccaro, president of HHAeXchange. I spend most of my time, I'd say, external to the company. So really out in the market, a lot of time working with, state Medicaid programs, Medicaid managed care plans, providers, self-direction space, fiscal intermediaries, a lot of advocacy that I do. So, I'm pretty passionate about this space, about government healthcare in general. I've been working in the government healthcare space, primarily Medicaid, but also other areas going back to 1990. So over 35 years. I've been with HHAeXchange now in a similar role as I am today for coming up on 10 years now. Really passionate about the home care space. I love it. And that's one of the things really with HHAeXchange that drives us at HHAeXchange and key part of our mission. HHAeXchange, let me say a couple words just about the company. We are a SaaS software company. That's what we do. We build software. We are not clinicians. We are not a provider. That's not our space. We build world-class software, and really with the aim of, I say, simplifying the administrative burden that all the various stakeholders incur in the ecosystem around personal care or home care services, with the end goal being that the individual in the home is able to receive the best care possible that they deserve.
Wow, you guys have done a lot in this area. So tell us how providers have been able to use your data so that they can better serve their consumers, but also how they could communicate better with their payers, the MCOs or the state, and setting them up for negotiation, for better rates, for improved outcomes.
Sure. One of the things that we see that came about is as part of the Federal Cures Act, right, is a focus on EVV, electronic visit verification, in this home care space, Medicaid home care space primarily. And with that, what you now see is a number of states have put in place compliance thresholds that they expect. New York has a 90% compliance threshold. Florida has a compliance threshold. Pennsylvania this past January 1st went to 85%. And there's a number of other states. I'm just giving a few examples. But what we see happening in the ecosystem now is it's very interesting where the providers and the payers, primarily Medicaid managed care plans, but also state Medicaid programs, everyone is starting to look at the data set in a common data set. And we see this with a number of our clients where we work in the full ecosystem, where we'll have, I'll say, common reporting that's going to all the different stakeholders around things like EVV compliance. And you see the states and the Medicaid managed care plans now engaging with the providers, sometimes even going to the point where they're engaging with caregivers to understand why EVV compliance levels are not higher, or any impediments that they may be hitting against, right, that are preventing it. With the end goal of ensuring that the consumer is receiving the proper care from the proper caregiver in the proper setting at the proper time. Right. And ultimately, all that's to improve the outcomes. And that gets used by both the providers and the plans for different types of value-based or incentive payment type solutions that get put in place, or to become preferred providers. We have seen in some states where providers have either been put on notice or removed from managed care plan networks because they're just not achieving a level of compliance that other providers are
Mhm.
able to.
And recently, you've introduced some new tools in terms of data backed information, even going to collecting some observation at point of care. And that's really enhancing the visibility of what goes on in the home. So tell us a little bit more about that. I'm a big fan of high performing providers, and I love our caregivers that go into the home. So all that really creates a whole, more full dimension of what's going on in the consumer's life.
Absolutely. Yeah. We are really strong believers in the value of the caregiver in the home, and how do we make that caregiver in the home part of the care team, the overall care team, because we think the work they do is tremendously valuable and important, and they tend to know that consumer in the home better than pretty much anyone else, often
Mhm.
better than family members do because they're spending so much time with them, right? So they
Mhm.
they recognize when there's a change in condition that's happening. They recognize if there's a tripping hazard in the home. They see a food insecurity. They see if something is changing in behavior, right? So we built out a tool on the infrastructure that came about as part of the Cures Act, right? So the Cures Act put in place, I'd say, with electronic visit verification with EVV, it for the first time gave access to the caregiver in the home, right? Nobody ever had that before. Now we have real time access to the caregiver in the home with those tools, and we built on top of that what we refer to as Care Insights, our Care Insights tool, where in essence, a payer, so a state Medicaid program, a Medicaid managed care plan, or a provider, an agency or a fiscal intermediary, would be able to ask questions or observations to the caregiver while they are in the home, or the caregiver can give observations while they are in the home. And just think of it as simple as you're using an app on your phone, right?
Mhm.
Yep, they use it to do a check-in, they use it to do a check-out, they do it to put in plan of care duties. But now they could answer certain observations, or they could let you know the person is not eating dinner the past 2 nights in a row. There's an infestation in the house that needs to be addressed. There's snow on the walkway, and we have a doctor's appointment we have to get to tomorrow. We need somebody to clear that because we have an ice tripping hazard outside. So these are the kinds of observations that ultimately now the caregiver has been aware of, but now they have a way to really raise that to their provider, to the managed care program, and an intervention could occur to help again ensure that the person's receiving the best care possible in the home.
Yeah, and it's fascinating because having been part of some of those conversations, we've seen that evolve to value-based care in a meaningful way, so that we're able to intervene and avoid higher levels of care. So, are there other elements of the EVV or the care insights that you have that contribute to that picture of value-based care?
Absolutely. So a couple of things I want to mention. One, I want to mention just we have seen managed care plans utilize the tool, and again, this we didn't envision this initially, right? But this is what starts to happen when all of a sudden, through the power of technology, you have access to that caregiver, and that caregiver now is able to become an informed member of the care team. People start to think about all new things that they could do. We see managed care plans now who are able to leverage the Care Insights tool to ask questions to ensure that they're getting the consumers in the right program. As you know, within Medicaid, there
Mm-hmm.
tend to be a number of different waiver programs,
Mm-hmm.
right? But now they're able to inquire on different aspects and determine, hey, maybe this isn't the right program. Maybe this other program is a more appropriate program for this person being. Maybe they can get more as a service. Maybe they get different types of service, whatever it may be, right? But we're seeing plans do that now, and we're seeing real engagement from the caregivers. So super, super happy with that. The other thing I'll mention is one of the other things we see happening is where the plans are managed care plans are starting to ask questions around, I'll say, different care gaps that they need
Mm-hmm.
for their integrated care, where integrated care being that the individual is dual eligible with Medicaid and Medicare. That health plan is responsible as the Medicare Advantage plan, but also as
Mm-hmm.
their Medicaid managed care plan, right, for those services. And what they're able to do is things like, let's say, simple item like, did the consumer go to have their annual physical? right? And they're offering now incentives for that to occur to the provider,
Mhm.
and the provider is able to work with their caregiver to ensure that's happening. It's getting scheduled. The individual is engaging, right? The consumer is engaging to go and receive those services. So we're seeing a lot of different use cases that are starting to come about now, as I'd say the technology infrastructure is in place.
That's really exciting. And we both I met you about 3 4 years ago as this was rolling out, and many of these features were becoming everyday events for us. One of the things I'm interested in getting your perspective on is how this is going to impact the recognition identification of high performing providers, because we know that managed care companies generally want to manage their networks. They want to work with the very best. So, how do you see that working into this dimension of what you do?
Absolutely. So first off, just on managed care companies and what we see as a trend happening across the country. And let me just mention HHA Exchange. We work in all 50 states. We're with over 30 state Medicaid programs. We interface or work with over 180 Medicaid managed care plans and 26,000 providers. So we have I'd say we have probably a true national perspective of the full ecosystem. And a couple of things that we see happening. One, we see networks, managed care networks for these home care services. They're looking to consolidate those networks. Where at one time they may have had 5, 6, 700 providers, they're now trying to consolidate down to 200, 250 providers. And as they do that, they're looking to identify, well, who are the right providers? So one component of that is access to care, right? Because that's clearly important. So
Mhm.
in rural areas, they need to make sure that they have appropriate options and care and so forth, right? But in addition to that, they want to make sure that they're working with their network includes the best performing providers. And there's a lot of ways to measure performance. I mentioned EVV as one of them. Who has more EVV? And the reason EVV is important is, one, it's fraud, waste, and abuse, but it also is ensuring again that that consumer in the home is getting the right service. That the caregiver, when did they get there? When did they leave? What duties are they performing? Can I get observations from home? There's a lot that comes to that to really improve quality of care and improve overall care. Um, the other thing that we started to see happen in terms of providers are becoming, I'd say, more proactive in terms of their engagement with managed care plans, where
Mm.
they going to them and they kind of demonstrating their data to them. We have a couple of clients. Some of them are, I'd say, a regional, one state kind of providers, and some of them are national providers in this home care
Mhm.
space that are putting different programs in place with managed care plans where they're demonstrating to them the value that they're able to bring in terms of reduction in missed visits, improved EVV compliance, improved clinical outcomes, right? So they're putting different measures in place and
Mhm.
they're using that as they speak to these providers. And some of that they also use as a preferred provider. Often they can negotiate an enhanced rate for some of the services that they're doing. Often they may be doing an enhanced service, right? As part of that,
Mhm.
receiving that
Mhm.
enhanced rate.
Absolutely. So, you and I met, and you've met me as an advocate. We care about the consumer first and foremost in this equation. And so, how do you see some of the advancements of data sharing going to become helpful for consumers, and how they even choose the best providers for them?
Sure. So first, let me just say, collecting data, that's a first step, right? That's not the answer to the question, right? It's the first step. Everyone has too much data today, is the reality, right? So what it's really about is as you're collecting the data, how do you leverage, the right business intelligence tools to sort of send off the proper alerts for where an intervention should be occurring. And I think that's really, making data actionable. I think that's really when we think about the future, right? That's really the unlock that we need to be thinking about. So I think it's really an exciting time in the industry. And I think
Hmm.
the home care space where we operate is so critical because these tend to be the highest need individuals and some of the most costly individuals and some of the most fragile individuals, right? And when you put all that together, I think really being able to focus on that population, that's where we can truly improve outcomes and start to bend the cost curve.
So, you and I can do this for hours on end. But Mandy wants us to stay on time. So, Mandy, where do you want to take us from here?
Well, thank you both. That was such a great discussion. And it's really great to see your perspective, Stephen. We really appreciate that. So you can find all of the podcasts wherever you stream your podcasts. We have it on our website, on YouTube, as well as Apple, Spotify, anywhere that you stream, you can find it. And Steve, we just want to say we appreciate your time so much, your expertise. We look forward to having you back, hopefully, in a podcast in the future. And with that, I think we're done for today.
Thanks for joining us today, Steve. And as always, onward.
The Care Payments Pod is brought to you by XtraGlobex. XtraGlobex is a strategic consulting firm that works with companies that are at an inflection point. We work with organizations to help manage that change and meet your goals. What is your challenge? Let us help take you onward. Link in the bio for a free consultation. Visit us at XtraGlobex.com.